Right now, your body may be running low on water, and the part of you that is supposed to warn you, that simple feeling of thirst, may have gone quiet without you even noticing. Picture this for a moment. It is the middle of the afternoon. You feel a little tired, maybe a little foggy in the head, and you tell yourself it is just your age, or a poor night of sleep, or the heat. You are not thirsty, so you do not reach for a glass of water, and that, right there, is the trap. Because after the age of 60, the alarm bell that should be ringing loud and clear has been turned down so low that you can be dangerously dry and still not feel the urge to drink a single drop. I am Dr. Daniel Mercer. For more than 18 years, I have practiced internal medicine, and I have sat at the bedside of more older adults than I can count, who arrived at the hospital weak, confused, and dizzy, when the real problem all along was something as simple as not enough water. And what troubles me most is that almost none of them felt thirsty on the way there. Their bodies had stopped sounding the warning. So if you are over 60, or you love someone who is, I want you to stay with me for the next few minutes, because I am going to show you 6 quiet signs of dehydration that seniors miss again and again, and exactly what to do about each one. Before we go further, if clear and honest health explanations like this are useful to you, please take one small second to like this video and subscribe to the channel. It costs you nothing, and it helps me reach more older adults who need to hear this message. Thank you. Now let us begin, because once you understand why your body hides this from you, every one of these signs will suddenly make sense. Let me start with the part that surprises almost everyone. We are all taught from childhood that when your body needs water, you feel thirsty. You drink, the thirst goes away, and balance is restored. And for most of your life, that system works beautifully. But here is what changes as we grow older, and it is something the Mayo Clinic confirms plainly. With aging, your body's fluid reserve becomes smaller, your kidneys become less able to hold on to water, and most importantly of all, you simply become less likely to feel thirsty in the first place. Think of thirst like the smoke detector in your home. When you are young, that detector is brand new, the battery is fresh, and it shrieks the moment there is the faintest wisp of smoke. But as the years pass, the battery slowly weakens. The detector still works, but now it takes a real fire, not just a wisp, before it makes a sound. That is exactly what happens to your sense of thirst after 60. Researchers have found that healthy older men who went a full day without water reported almost no increase in thirst at all, while younger men in the same situation were desperate for a drink. Same lack of water, completely different alarm. And it is not only the weak alarm working against you. Your body holds less water to begin with, so you have a smaller cushion before trouble starts. Many common medications, especially water pills, blood pressure pills, and certain medicines for the heart, gently pull more fluid out of you. Conditions like diabetes raise the demand for water, and sometimes simply getting up to use the bathroom is difficult or uncomfortable, so without meaning to, people start drinking less just to avoid the trip. Put all of that together, and you can see why dehydration sneaks up on older adults so quietly and so often. It is not carelessness. Your own biology is hiding it from you. So the answer is not to wait for thirst. The answer is to learn the other signs your body gives you, the ones that do not depend on that broken alarm. Let me walk you through all 6. The first sign is the one we just talked about, and it is the most dangerous precisely because it feels like nothing at all. You are simply not thirsty. Hours go by, and the thought of water never crosses your mind. I want you to flip this completely around in your thinking. After 60, the absence of thirst is not proof that you are fine. It is not a green light. It is simply your old smoke detector staying silent. So please do not use thirst as your guide anymore. Instead, drink on a gentle schedule, a little at a time, throughout the day, whether you feel like it or not. We will talk about exactly how in a few minutes. The second sign is one you can actually see with your own eyes, and it is one of the most reliable of them all. Look at the color of your urine. When you are well hydrated, it should be pale, the color of light straw or weak lemonade. When you are running low on water, it turns darker, more like apple juice or amber. The Mayo Clinic lists dark-colored urine as a clear warning sign to watch for. Here is why it happens. Your kidneys are trying to protect you by holding on to every drop of water they can, so they make a smaller amount of urine, and what does come out is far more concentrated. Pay attention, too, to how often you are going. If you suddenly notice you have not needed the bathroom in many hours, that is your kidneys quietly rationing water behind the scenes. Dark urine, or far less urine than usual, is one of the earliest honest signals your body gives you. The third sign is your mouth and your lips. A dry, sticky mouth, a thick feeling on your tongue, lips that crack at the corners. These are all signs that your body is short on fluid. You may notice it most when you wake in the morning, or when you try to swallow a dry piece of toast and find you need a sip of water to get it down. Some people also notice a dry, gritty feeling in the eyes, or a headache that creeps in by the afternoon, because the brain itself is sensitive to even a small drop in water. Now, I will be honest with you, a dry mouth can also come from breathing through your mouth at night, or from certain medications, so it is not perfect on its own. But when a dry mouth shows up alongside the other signs on this list, take it seriously. It is your body telling you that even your saliva, which is mostly water, is being rationed. There is another clue doctors sometimes check, and you can gently look for it too, though I want you to treat it as a soft hint rather than proof. Take the back of your hand and lightly pinch the skin, then let it go. In a well-hydrated person, it springs right back. When the body is low on fluid, the skin can be slower to settle back into place, a little like a tent that stays standing for a moment too long. We call this skin tenting. I say treat it gently because as we age, our skin naturally loses some of its bounce, so this test is less reliable in older adults than in the young. Still, paired with the other signs, a slow, doughy skin can add to the picture. The fourth sign is dizziness, and especially that lightheaded swimming feeling you get when you stand up from a chair or rise out of bed. This one matters enormously for older adults because it does not just signal dehydration, it can lead straight to a fall. Here is what is happening inside you. Water is a major part of your blood. When you are low on fluid, the total volume of blood in your body actually drops. So when you stand up and gravity pulls that blood down toward your legs, there is less of it to push back up to your brain. For a few seconds, your brain is short on its supply, and the room seems to spin or go gray. Doctors have a name for this drop in pressure when you stand, and the simple cause behind it is often that there is just not enough fluid in the tank. The Mayo Clinic notes that dizziness and lightheadedness are symptoms of dehydration, and that if you feel them and cannot drink enough fluids, you should seek medical attention. So if you have been feeling unsteady when you rise, please do not just brush it off as old age. Rise slowly, give yourself a moment with a hand on something solid, and look at whether you have been drinking enough. Low water may be the hidden cause, and it is one of the easier ones to fix. The fifth sign is one almost everybody blames on something else, and that is plain tiredness, a deep, dragging fatigue, a heaviness in your arms and legs, a sense that you have no energy even though you have not done very much. When your body is short on water, your blood becomes a little thicker and does not move as freely. Your heart has to work a little harder for every beat, and oxygen and nutrients reach your muscles more slowly. Think of it like a garden hose that is running low. The water that does come through is sluggish and weak, and nothing downstream gets what it needs. The result is that worn-out, sluggish feeling all over your body. Now, of course, fatigue has many causes, from poor sleep to low iron to your medications. But I cannot tell you how many tired patients I have seen perk up within a day or two simply by drinking enough water again. It is one of the first things worth checking, because it is so simple, so free, and so common. And the sixth sign is the most serious of them all, and the one I most need you to remember. It is confusion, a sudden change in thinking. Your mother, who is usually sharp, becomes muddled and cannot follow the conversation. Your husband seems unusually sleepy, hard to wake, or strangely cranky, and not himself. This is not a small thing, and it is never just normal aging coming on overnight. Your brain is enormously sensitive to its water balance, and when an older body becomes badly dehydrated, the brain is one of the first organs to show it. The Mayo Clinic is direct about this. If an older person becomes confused, cranky, sleepier, or less active than usual, you should call their healthcare professional. And if someone has no energy and is not responding to others, that is a medical emergency, and you should get them to a hospital right away. Please do not wait this one out. Confusion that comes on quickly is a sign to seek care, not to sleep on. Let me tell you about a patient of mine. I will call her Ruth. Ruth was 74, lived alone, and she was, by every measure, a careful and sensible woman. One summer, her daughter called me, worried, because Ruth had become forgetful and oddly quiet over just 2 or 3 days, repeating herself, losing her train of thought. The family was terrified it was the beginning of dementia. But when I asked the simple questions, the picture came clear. Ruth had not felt thirsty, so she had barely been drinking. Her urine, she admitted, had been dark for days. She felt tired and a little dizzy when she stood. She was not losing her mind at all. She was profoundly dehydrated. Once we gently restored her fluids, the fog lifted, and within a couple of days the bright, sharp Ruth her family knew was back. That is how convincingly dehydration can imitate something far more frightening in an older adult. And that is exactly why I want these 6 signs living in your memory. So now you know what to look for. Let me give you the simple, practical way to stay ahead of all of it. The single most important rule is this: do not wait until you are thirsty, because we have already learned that, after 60, thirst arrives late or never. Instead, drink on a gentle rhythm through the day. Have a glass of water when you wake up, before that morning thirst would ever appear. Have one with each meal. Have one in the middle of the morning and one in the middle of the afternoon. Keep a glass or a bottle where you can see it, on the kitchen counter or beside your favorite chair, because what you see, you remember to use. Small, steady sips spread across the day are far kinder to your body than trying to gulp it all down at once. Now let me clear up a few common mistakes I see. The first is thinking that coffee and tea do not count. The truth is that for most people, the water in a normal cup of coffee or tea does add to your daily fluids, though water itself is still the best choice. The second mistake is forgetting that food carries water too. Soups, broths, melon, cucumber, oranges, and many fruits and vegetables are full of water and quietly help keep you hydrated, which is wonderful news if drinking plain water feels like a chore. The third mistake is drinking far less in winter. We feel less hot, so we forget, but the dry indoor air and the heating in your home can pull moisture out of you all season long. And the fourth mistake is cutting back on fluids in the evening out of fear of nighttime bathroom trips. Rather than going dry, talk to your doctor about shifting more of your drinking to the earlier part of the day so you stay well watered without losing your sleep. Now for the safety part, because honesty matters most here. For most older adults, drinking a little more water through the day is one of the safest things you can do. But there are people who must check with their own doctor first, and I want you to hear this clearly. If you have heart failure, kidney disease, or any condition where your doctor has told you to limit your fluids, then you must follow their guidance, not a general rule from a video. For some people, too much fluid can be just as dangerous as too little. So please, if you are on fluid restrictions or take water pills or other medications, ask your own doctor what the right daily amount is for your body. And let me say this plainly. Never stop or change any medication on your own. Bring this conversation to your doctor and let them guide you safely. Here is the simple habit trick that ties it all together, because knowing this and actually doing it are two very different things. Attach your water to something you already do every single day. You already take your morning pills, so drink a full glass of water with them. You already sit down for the evening news, so keep a glass on the side table and sip it as you watch. You are not adding a brand new chore to your day. You are simply pairing water with the moments that are already there. That is how a good intention quietly becomes a lasting habit. And here is a small bonus that stacks neatly on top. Pick up a clear water bottle, the kind marked with the hours of the day along the side, or simply set out the amount you intend to drink each morning. When you can see your progress with your own eyes, you no longer have to rely on memory or on that broken thirst alarm. Your eyes do the remembering for you. It is a tiny tool, but for many of my patients, it has made all the difference. So let me bring this together for you. After 60, your sense of thirst grows quiet, which means you can be dehydrated and never feel a thing. So instead of waiting for thirst, you watch for the 6 real signs. 1. You are simply not thirsty and you no longer trust that silence. 2. Dark urine, or going far less often than usual. 3. A dry, sticky mouth and cracked lips. 4. Dizziness or lightheadedness, especially when you stand. 5. An unusual dragging tiredness. And 6, the most serious of all, confusion or a sudden change in alertness, which is a sign to seek care right away. And the answer to nearly all of it is gentle and free. Drink small amounts of water steadily through the day before thirst ever shows up. Keep it where you can see it. Pair it with habits you already have. And watch over the people you love for those same 6 signs, especially the confusion, because they may not feel a thing until someone who cares is paying attention. If this was helpful to you, please subscribe and stay with us here. This channel exists to help you read the quiet signs your own body gives you, so you can stay strong, clear, and independent well past 60. I would be honored to keep walking that road with you. Take good care of yourself, drink that next glass of water, and I will see you in the next one. And one last important note, this video is for general educational purposes only, and it is not medical advice. Always speak with your own qualified healthcare provider before making changes to your fluids, your diet, or your medications, and seek medical care promptly for sudden confusion, severe dizziness, or any symptom that worries you. Your doctor knows your body. Bring these signs to them and let them help you stay safe and